Okay, so welcome everyone to this session today to launch the Academy of Medical Education during conflict. We have a group of distinguished speakers, live experiences that we're going to share today. We are going to explore a Sudan case as a study case, but we promote this model for different countries in conflict. We are hoping that this as well session will be an opportunity for networking. So please introduce yourself in the chat box. Leave your email if you would like to be contacted. And hopefully as well, if you would like the record, we can share the record with you. So starting swiftly because we have a list of speakers and to leave some time for discussion. I'm going to start by giving a background about the Academy and the work that we are hoping to develop in the next 12 months, moving on to 2026. This is the program for today. And thank you for the speakers for their efforts. Moving to the Academy itself, one of the main principles is to promote simulation-based education as a tool for humanitarian response to enhance medical learning during humanitarian crisis. And we are going to give examples, hoping to convince those who are still not sure about simulation-based education. In the next slide, we're going to talk about the rationale, which is sadly is shared among most of the countries and areas where there is armed conflict, but even during natural humanitarian crises. And this is in Sudan at the moment is a security situation. There are still civilians trapped in the red zone in the intensive violence areas. We know that there is compromise on health access, where hospitals and universities were destroyed and invaded. We have 11 million displaced population and 2 million refugees. This is the worst and the largest humanitarian crisis worldwide, but you can hardly hear about it in the news. And we have different locations for the medical educators and the students. Some are still in the red zone, others are displaced internally, and others moved to neighboring countries. Together with issues with digital access and electricity interruption. This situation can be shared in different, similar condition. Just as a background, the simulation-based education is not a new concept in Sudan. And there has been a lot of efforts led by, the distinguished speakers that we're going to talk today. But in particular, I would like to pay attention to the conference in February 2023, prior to the eruption of the war. We were in Khartoum. It was a very sort of combined effort by the local educators in Sudan and the medical diaspora in a conference to discuss how to enhance medical learning and how can we help. We had dreams, hopes that we're going to be moving forward. Sadly, the war erupted. So there were brainstorming sessions about what can we do now. And once again, simulation-based education was explored. What we were aiming for in 2023 and what we have achieved is to develop a faculty in partnership with the Sudan Medical Specialization Board and with medical school consortiums. That is really important for quality assurance and for governance and accreditation. And what happened next after that, which will be explored further, is the development of the SBE family, where 960 medical students completed training in emergency scenarios. These scenarios were adapted to fit with the context in Sudan. And I'm going to mention the two platforms that we have used, the full code and Oxford Medical Simulation, where we had more than 50,000 episodes of medical students using the full code. And with Oxford Simulation as well, we had more than 200. But after that, we have others who joined, and we're really grateful for their support and partnership, like SimFlow and behind the knife. And as well, we have support from Access to BNF and Talkspace. And actually, the support from, I would say, simulation application is something that we are hoping that the humanitarian international community will recognize, because we will show you how it will make a difference. In the next slide, we obviously would like to highlight the challenges which we want to work through it in the academy. And that, first of all, simulation-based education is not a tool that is only for the north part of the world. It has been used, and it should be used and further developed in the South Globe. Uh, in the context of conflict, there is always the issue about security, the displacement, the serious cases that the medical staff will face, like conflict-related sexual violence, the psychological trauma, and acute starvation. In our model, we try to focus on these areas. But as well, the Academy promotes digital access as a human right, and that's internet connectivity, electricity supply. And we are aware that there are other challenges, like what happened recently in Sudan with the eruption of the war, with the bank system collapse and looting of solar panels and internet satellites. The main challenge that is facing such programs is sustainability. We have to accommodate that the staff and the students are in different locations, the EIT and the logistics, the subscription for softwares if we need to use it, and the admin support uh, for organizing all of this training. The feedback that we have received along this journey was very helpful to modify, adapt, improve our work, but as well it proved that it is needed, and it was a healing experience for those who are inside Sudan, refugees, and as well for us as medical diaspora. And the feedback from the students, which you will hear shortly, was really as well helpful for us to improve our performance, but specifically that it was a safe space for learning. Without partners, this work will not happen. And partnership is the key, and this is what as well in the academy we would like to continue to develop. It started with Shabaka Social Enterprise, the International Organization of Migration, the Sudan Medical Specialization Board, medical schools, the Emergency Response Room, SAMAM, and a few applications, and the medical diaspora. And we are very excited that we are going to develop partnership with Afford moving on in 2025. For those like me who like visual evidence of how much engagement was there during this program, because it's very difficult for us to reach all of the students because of the security and the internet, we have used different platforms. And we are hoping in 2025 we're going to use more. So the Academy promotes that part of the health cluster and the humanitarian response that should be included in the humanitarian funding is medical education, because medical education will enhance the response to the needs of the displaced population, of the refugees, and the host communities, and the engagement of medical diaspora and the advocacy, and the support and donation and free subscription in this model saved almost more than $250,000. If you are interested in the model, we would like to take you through the three areas about how it can be an essential part of humanitarian response, how to perform blended medical learning model, and how to get an effective medical diaspora engagement. And I think that's final slide. We are going to put our contact emails at the end as well. So I will now hand over to my colleague, Dr. Zainab, to introduce our first speaker, our honorary advisory professor, Raof Sharfi.
Thank you so much, Dr. Sara, for the background of the Academy of Medical Education during conflict. I'm Dr. Zainab Hamid. I'm a pediatric trainee. With Dr. Sara, I'm a co-founder of AMEC. I will be taking you through this program to introduce our esteemed speaker. Our first speaker will be Professor Raof Sharfi. It's actually my honor and pleasure to introduce you, Professor Raof Sharfi. Professor Raof is very senior consultant of surgery urologist, and he is the academic secretary of Sudan Medical Specialization Board. He is an international figure. Welcome, Prof.
Good afternoon, everybody. Thank you so much, Zainab, for the introduction, and thank you for organizing this very important meeting. Actually, I'll start with a few words introduction to Sudan Medical Specialization Board. Can I have my first slide, please? Yeah, Sudan Medical Specialization Board actually is an independent academic institute. Among many functions, its main function is to train and qualify medical and health professionals to obtain higher degrees in many specialties. Actually, it incorporates within about 50 specialty councils, and the number of trainees within it are about 11,000 till the 15th of April, just before the eruption of the war conflict in Sudan. But the onset of war had very adverse effects on continuity of everything of SMSP, like interruption of all types of training, displacement of over 58% of its trainees and trainers to many parts of Sudan, neighboring countries. Most of them are actually in Egypt, Saudi Arabia, and other neighboring countries like south of Sudan, Chad, Ethiopia, and many, many others. And together with this destruction of most of the health delivery units resulted in near collapse to the whole health system in Sudan. Yes, Zainab? Yes, please. Now, the response was of Sudan Medical Specialization Board cabinet was very quick with the onset of the war by establishing an emergency unit in Medani, which is the second biggest city, then later on Lungula, with main objectives of collecting data for the displaced trainees and trainers and mapping relatively safe training centers in different parts of Sudan and abroad by addressing similar international bodies to accommodate its trainees with training units. And we had many MOU agreements with many international organizations. We activated those. Then we started exploring for online training and other programs that can bridge gaps in the curricula like SBE, touch surgery, telemedicine, and others. Yes, and actually SBE was one of the very promising programs to start with. And in collaboration with Shabaka, IOM, and other organizations, an active program was initiated thankfully by Dr. Sara from the UK and organized by Dr. Zainab here in Cairo. And the start was actually, we had many very successful Zoom meetings organized by Dr. Sara from UK and run by Dr. Zainab here in Cairo, followed by face-to-face 2 days workshop in Cairo, where which was attended by about 32 members forming a faculty representing different specialties, Sudan Medical Specialization Board. And this faculty was very well trained in writing scenarios directed mainly to emergency conditions during humanitarian crises like gender, male violence, different types of trauma and malnutrition, and many others. Yes. Yes, please. And this is one of the very first meeting. Those are the faculty in Cairo members who attended the first meeting and had training. They are representing nearly about 30 of the specialty councils of the SMSP. Yes. And this was the agenda of the first meeting to the faculty in Cairo, the roadmap. Yes. So at that time, we felt that it is very important to find a suitable venue so that we can do our work regularly. And with a very kind sponsorship by Shabaka and other organizations, we had a very suitable small office with a meeting room in which we can follow up the progress of SB and other activities. We take regular weekly meetings in this office. We train small groups. And this is a very good site for communicating with SPE cabinet to arrange for inclusion of SPE in the curriculum of different SPEs. But this office needs real support for sustainability of this very promising program. Yes. This is one of the activities which we are running in Cairo, training more trainers in SPE. And again, this is the last group actually who had training in Cairo. So why SPE? Definitely, we know it is an effective educational tool. It creates a safe and immersive learning environment. It improves knowledge retention. It can lead to more focused guidance on specific topics. And accordingly, we feel that SPE is worth serious consideration, and it can lead to improve the efficiency of both trainers and trainees for education. Yes. So what will be the role of Sudan Medical Specialization Board? We admit, number one, our real commitment, number one, to organize regular meetings with its specialty councils, and we already started doing that. We'll be able to train more of trainees and trainers at different levels of training, and to encourage introduction to the different curricula of SMSP. And we'll monitor its progress very carefully. And recently, we are started introducing full code to R1 the trainees who are planning to start training in the near future. And this is actually was one of the recent meetings with those who obtained their entry examination and starting the training. A nice introduction was done by Dr. Zainab to SBE and Oxford Full Code. Yes. But yes, having said this, we have got some obstacles that challenges, as mentioned by Sara, especially in remote rural areas of Sudan, like lack of energy supply, lack of methods of communication, and difficult transportation methods, digital access, like internet hubs, security for the health professionals, and access to trainees in remote parts of Sudan. And sustainability is one of the big headaches to us. We hope we will find ways by which we can sustain this program and to have some subscription cost solved. Yes. So today, 18th of February 25, launches this very ambitious program, and SMSP admits taking all efforts to consider it as one of its accredited training programs. And we will work in close collaboration with different bodies and organizations that can keep SP promotion and sustainability. And finally, actually, a very special thank and appreciation goes to Dr. Sara and Zainab for their relentless efforts to introduce, train, monitor the progress of this program, and other activities such as telemedicine, touch surgery, behind the knife, and many others. And many thanks to Shabaka, IOM, and all who are participating actively in running this program. And thank you so much for all of you. Thanks. شكرا جزيلا لكم. The last exam is Zainab.
Thank you very much, Professor. Thank you for the insightful presentation and addressing all the great efforts are going by the Sudan Medical Specialization Board. Let me introduce the second speaker, Dr. MohammedElfatih. Dr. MohammedElfatih Ahmed is an internal medicine consultant. He's an evidence-based medicine expert, and he is a permanent and valued member of simulation-based education family, who are representing the national program for undergraduate in the SBE. The SBE family dedication and contribution have been instrumental in shaping the future of medical education in Sudan. Please join me, Dr. MohammedElfatih. Step in, please.
Assalamu alaikum. Thank you, Dr. Zainab, and it's a great honor to welcome you all on behalf of the SBE board members, Prof. Suad, Ms. Safa, Dr. Manal Mohammed, Dr. Zainab Abdurrahman, Dr. Sana Al-Agra, Dr. Shayma, and Prof. Al-Badri, and Dr. Zainab Hamid, the heart of the family, and our leader, Dr. Sara. Today, I will share a journey that highlights not only the evolution of simulation-based education, but also the resilience, innovation, and hope that have driven this national program forward. This initiative is not just introducing for a new teaching methods, it's about transformation. So welcome, and let's begin. In times of war, the first casualty is education, but even in the darkest moments, innovation can light the way forward. Simulation is the bridge between classroom learning and real-world clinical practice, especially when that real world is a war zone. So the urgency to ensure students can practice case scenarios before working on real patients, to provide a uniform training models across different geographical areas, to develop skills in trauma, pediatric, ops, surgery, medicine, and emergency cases. So simulation training is not a luxury, it's a necessity. With a limited access to real war patients nowadays in Sudan, simulation ensures that students develop essential competencies. And I mean the clinical and the non-clinical, the technical and the non-technical skills in a structured, controlled environment. We cannot wait for hospitals to reopen. We must bring the hospital to the students through simulation. This is a simple faculty development matrix for our work during this journey. The SPE empowered 34 educators with cutting-edge simulation training. 14 leading universities are shaping the future of medical education through the SPE national program, and almost 1,000 plus future healthcare leaders was trained, and the 5 universities leading faculty was established. So really is a revolutionized medical education with 98 virtual scenarios was conducted in 39 power-packed sessions. Those are the platform that we use in the training, as Dr. Sara mentioned earlier, the Oxford medical simulations and the full code medical simulation. If students cannot come to the hospital, we will bring the hospital to them. So we approach this journey through 3 phases. Phase number 1 is the emergency simulation deployment. The SPE team deployed under the leadership of Dr. Sara and trained 1,000 plus students in different case scenarios and introduced virtual case-based discussion. Phase 2, to establish universities' faculty simulation hubs, which is already set up to 5 simulation faculties, launch blended training models, and develop standardized CBD using simulation. And the last phase, national expansion and long-term integration. We're looking up to secure partnership for sustainable funding and to integrate the SBE in the medical school curriculum and develop a long-term faculty development pipeline. National Simulation Network is not just about replacing lost hospitals. It's about redefining how we train the next generation of Sudanese doctors. So let's replace the old osteoarthritic backbone of medical education with new simulation, which will be the new backbone of medical training in Sudan. The challenge that we face nowadays, the funding constraints, we need to secure global grants, diaspora support, and public-private partnership to ensure sustainable funding for this program. And shortage of the faculty, we need to implement peer-to-peer teaching and to remote telesimulation mentorship to address the lack of experienced faculty. The war, unfortunately, has stolen our hospital, but it will not steal our future doctors. So to ensure sustainability, Sudan must leverage the technology and international collaboration to build resilient medical education system. And this innovation is a promise for significant improvements in the competencies, the clinical and non-clinical skills, and the accessibility. This is the future that we want to see. We cannot afford to wait. The future of Sudan's healthcare system depends on what we do today. So this is a call for action for all the participants. We need to provide a safe environment for students to practice without risk to the patients. Safety comes first. To decentralize approach to ensure maximum student reach across conflict zones, and to make a measurable metrics to allow continuous assessment evaluation for improvements of simulation medical education. So let's to see through this lens, let's turn this vision into action by supporting the next step. All of you can play a crucial role in revolutionizing medical education and ensuring a brighter future for healthcare in Sudan. So the steps that the participant on this webinar can help us in detailed funding proposal for potential donors and international organizations interested in supporting the program, to engage with the stakeholders here in this webinar and policymakers to implement the national SPE program, and to secure international funding and support for the long-term sustainability. Thank you all for your support and engagement, which are crucial for the success of this program. Together, we can overcome the challenges posed by the conflicts, and we will build resilient innovations and hope for education system in Sudan. Thank you for your attention and commitment to this vital cause.
Thank you very much, Dr. MohammedElfatih. Thank you so much for the added hope. Okay, so as a graduate of Ahfad University for Women, it's my honor to introduce my mentor and actually my role model in medical education, Dr. Tahra Mahdi, the Vice Dean of Academic Affairs, School of Medicine at Ahfad University for Women. She is the Director of the Master's Health Professional Education at Sudan Medical Specialization Board. join me to welcome Dr. Tahra.
شكرا جزيلا. بسم الله الرحمن الرحيم. السلام عليكم. Good day to you, everyone. First of all, I would like to thank you, Zaina, for this introduction and to thank the Academy and to congratulate you and congratulate ourselves for this launch of a successful initiative that, as they say, hit the ground running. So thank you so much. Can you share? Yeah, okay. So my speech is going to be about our experience in Ahfad University for Women, and I can call what happened to us and what's happening the Phoenix Project. And as you know, the Phoenix rises from its ashes. So we hope that we will rise, inshallah. Zainab has already introduced me. I am a medical educationist in Ahfad University for Women. Also, I work as the director of the educational development or the health, the Masters in Health Professions Education at Sudan Medical Council. And also, I'm also a teacher in Maastricht University in the MHPE. Next, Zainab. So I'm going to talk about, this is the roadmap of my speech. I'm going to talk about the project. Why does it matter? Did it matter for us? And it will matter again. And what happened? How did we embrace it? And to share our reflections about what happened and the path forward, and to end by our conclusion. Next, Zainab. Yeah, so the initiative, as just explained by my colleagues before me, was from Shabaka and the IOM, and we thank them for that very much. Ahfad actually pioneered in integrating it or considering it for undergraduate education. As Sara mentioned, they were considering it mainly in postgraduate education, and the preparation for this effort started since 2023, so immediately after the war. Next. Yeah, so we think it matters very much, as Mohammed just mentioned, the hideous war in Sudan and its destruction of medical education. Everything stopped, and you know all about the devastations, the humanitarian losses that we have. So this was very suitable, especially that the area of simulation in medical education is now high on the international agenda, and many voices are in its support. The other reason is, for us in Ahfad School of Medicine, it aligns with our legacy and it aligns with our program. Ahfad was from the pioneers in the field of medical simulation. Our skills lab started since 1994. So everything was in line with us. And thanks to the generous support of Shabaka and the IOM, we integrated both tools, both platforms in our final phase of the curriculum. And currently we're only what's working now is the final phase, and this was integrated in the curriculum. Or with the help, of course, of Dr. Sara and Dr. Zainab, and we're very thankful to them. They managed to train most of our faculty and also students. And for us to ensure that it's going to be the proper transformation Mohammed was talking about, we established well-structured committee for simulation-based education that will manage or is managing the program and making everything possible to make it work. Zainab? So this committee mainly worked to engage students to continue the efforts of faculty development and to engage all relevant units, and also to do the required curriculum adaptation. We thought that for sustainability and for proper integration of the program, it should have like weight, be assigned weight in credit hours, and to be each unit to see the cases and their outcomes, which are relevant to these cases, so as to link the program very closely to our curriculum, and to make the students see that it's not a side track, but it's part and parcel of our curriculum. Yes. So as I said, in order to do that, we work to contextualize it. Institutionalization was through this committee and through assigning specific credit hours, but also all the units were encouraged to look into the cases and to see their relevance to our context, to Sudan, of course, and to do the required adaptation. And thanks to Dr. Sara and Dr. Zainab, they allowed this and they encouraged this, that we see how to bring the relevance to our curriculum and to the cases. And there is a direction also to include new cases that are not there maybe. And this already, our staff is being trained on how to do that. So the curriculum integration and assigning weighting credit hours was something crucial, and also this flexibility in changing the cases. And of course, we have ongoing student support. Not only they are, of course, they are part of the program, so they enter the platforms, but also we support them through other social media platforms. So our reflections about this journey, we of course see very great gains. We managed to sustain the clinical training amid this crisis. Of course, also our staff championed the initiative across other medical schools, and they are working as advocates now for this course or courses. And also our students, they owned the program and the initiative, and some of them even documented its impact using empirical means. And of course, as any other thing in the world, it has challenges. Some of the challenges are can be dealt with through the structure of the program itself. But one of the major challenges is the war itself and the continuation of war, because it threatens the existence of us as people, not just the programs. And the sustainability is another big issue. We hope to overcome it through our collaboration all together. Our prospect for the future is to expand the program to include it in other phases of our curriculum, because we are using clinical skills are introduced to students since they enter the school as part of our curriculum philosophy, and also to use it as a platform to leverage or to include interprofessional education, which is also a direction that we're holding dearly and we are heading towards. Lastly, my final slide is that simulation, especially during this time, it is not just a technology, it's a lifeline for us, for medical education in crisis all over the world. And our experience shows that with the right partners, the tools, and the commitment, learning will never stop and can continue no matter what. And we think now it is the time to expand and to innovate and to shape the future of healthcare education in our nation and above. And of course, together we rise. Thank you very much. Thanks.
Thank you very much, and thank you all for listening.